You're watching North State Health, the North State's first local health program.
Good afternoon, I'm Tim Mapes. Thank you for joining us for North State Health, the only show dedicated to bringing you the information you need to live a healthier and a happier life. Our guest today is Dr. Ray Powell from Physicians Plan Weight Management. Dr. Powell, thank you for being here with us again today.
Thank you for having me.
All right, for the benefit of our viewers out there that may not be familiar with Physicians Plan Weight Management, let's start a little bit with your experience, how long you've been in the North State, and how you got into weight management.
I've been in the North State since about 2001. We moved from South Carolina here with my whole family. My family's from Reading and from Chico. And I got into weight management kind of a long way around, where I was actually an emergency medicine doctor first, and I got injured in Desert Storm in flying in the C-141 and the F-111, and I ended up becoming a disabled vet, and through my injuries I ended up gaining about up to about 250 pounds. And so I started really learning about nutrition through my father, who also did weight management, and it just became kind of a labor of love where I started getting into it full time.
Okay. Well, the patients would want to know out there that you definitely know what you're talking about. Talk a little bit about, just really quickly, your board certification that you have.
Right, I'm board certified in emergency medicine, but then I became board certified in bariatric medicine, which is the management of obesity as a disease. And then my third board certification is as a physician nutrition specialist, which really there's only about 44 in California and only one north of UC Davis, which is me.
Okay. Well, talking about Physicians Plan Weight Management, some people may wonder about the name of your practice.
Right.
Talk a little bit about, it's not just weight loss, but it's weight management.
Exactly.
It can be gaining as well.
Right, so my sign, I always tell this to people outside the building, is it doesn't say weight loss, it's weight management. So we deal with people that have to gain weight. We deal with people that have had chemotherapy, that have cancer, that are trying to gain weight. God, I've got liver transplant, kidney transplant patients. I have people that are on dialysis even. And so we're really looking at nutrition and making sure that they can live as healthy as possible.
Okay, so we are talking about weight management, so whether it be gaining or losing.
Right.
Today's topic, we're going to focus on somebody comes to your practice and they are either losing or gaining weight. Why does Physicians Plan Weight Management deal in facial aesthetics? What is that?
And we do facial and laser aesthetics. And so really what's happened is, over the years of doing this for 15 years, I've had people that are coming in that are losing weight, they're feeling better about themselves, they're eating better nutrition. They also want to look better. And I'm probably the #2 most vain person in Northern California. So it became kind of a labor of love, because I really started looking at myself as well as trying to keep as healthy and as youthful as possible. I'm not, you know, nobody tries to look 21 again unless you are 21. But it's one where the people get a rapport with us, that we just kind of delved into the aspects of really what we call non-invasive aesthetic procedures. So it's not plastic surgery, but more of the things that work on the surface. And this picture shows a great description of kind of the aging process that we go through. Okay. And so it shows the difference in the lines and the difference in the amount of what gravity does to us. And what we try to do is just make the people look better, just youthful and healthy, without making them look like they've had something, you know, dramatically done.
Yeah, and you were saying it's something that you kind of take your time to get these results, so people don't have to worry about having this type of procedure. And we're going to talk about some of the, you know, the products and the treatments that you do a little bit later in the show. But people don't have to worry when they see this that they're going to look like one of those celebrities that you see the
There's a
photos of.
lot of myths about Botox and about the dermal fillers and things like that we'll talk about, and kind of go through the kind of alleviating some of those myths, so that people really understand what the science is behind it, and the art.
Okay, and so you were saying this is also a science and then also a medical procedure.
Exactly.
You consider it.
Exactly. I'm very much in the aspect that it's a medical procedure that has to be taken care of one-on-one with the patient as well as the physician. It's not to go do a Botox party somewhere or anything like that. It's really an issue of making sure it's done in a medically safe way.
Okay. Now, why would somebody need to have this done if they were having, you know, either having weight loss? Is this something that comes along with, you know, they start losing weight?
They do. They feel better about themselves. Then they really want to look better, and they start really looking at themselves more. A lot of people that are overweight, they really don't take the time to look at themselves, because they're really in kind of almost a self-imposed denial. And as they start feeling better, they really start saying, wow, you know, I could look better than this even. And so they want somebody that has the skills, and as well as they have the rapport with, to do the procedures for them.
Okay, so it's something that one goes along with the other as they start feeling better.
Right.
Well, why not just keep going?
Exactly.
All right. Well, thank you, Dr. Powell. We are going to talk about the products and some of the procedures that Dr. Powell does in his practice when we come back. So we still have a lot of information to get to. You're going to want to listen to here on North State Health. So stay with us just after this 1-minute break. But for more information on today's topic or any edition of North State Health, just go to our website at krcrtv.com/North State Health. You can watch today's episode in its entirety from your computer or laptop. We'll be right back.